Your blood pressure is higher right now than when you woke up this morning, and it's going to keep rising until you go to sleep, unless you do something specific before bed. Hello, I'm Dr. Akio Matsumoto. I've been treating hypertension for over 40 years, and there's a pattern I've observed in almost all my patients. Most have their pressure controlled during the day with medications, but at night, while they sleep, their pressure spikes, and nobody realizes it until it's too late. It's called nocturnal hypertension. And it's silent. You don't feel it. It doesn't hurt, but it's damaging your heart, your kidneys, your brain. Every night, while you sleep, doctors measure your pressure in the office. During the day, when it's relatively controlled, but nobody's measuring your pressure at 2 a.m., at 4 a.m., when your body should be in deep rest, but your pressure is in the danger zone. And the pills you take in the morning, by the time night comes, their effect is wearing off, right when you need them most. But there's something from traditional Japanese medicine, a pressure technique on specific points on your thumbs that, when done before sleep, keeps your pressure stable all night long. It doesn't replace your medications, but it enhances them, and it attacks something medications can't, your body's nighttime stress response. 4 months ago, one of my patients, Margaret Davis, 68 years old, came to see me because she was scared. Her cardiologist had told her that her nighttime pressure readings were dangerously high. They'd increased her medication dose twice, and it was still high at night. She told me, "Doctor, I'm afraid to fall asleep. I'm afraid of having a stroke while I'm sleeping and not waking up." I asked her a simple question. "What's the last thing you do before going to bed?" "I take my pill, brush my teeth, and go to bed," she answered. "And your body? Do you give it any signal that it's time to lower the pressure? Or do you just expect it to happen?" She looked at me confused. I explained something that changed everything. Your body has a nervous system that controls blood pressure automatically, but that system needs to be activated correctly before sleep. If you go to bed without activating it, your body goes into alert mode. Your pressure rises, your heart works harder, and you spend 8 hours in that state. But if you activate the right points on your thumbs, points that are directly connected to your parasympathetic nervous system, you give it the right signal. Your body enters real rest mode, your pressure drops, and it stays low all night. I taught Margaret this 3-minute technique, specific pressure on 3 points on each thumb, in an exact sequence before bed. The first night, her nighttime pressure dropped 15 points. The first night. After a month, her nighttime readings were in normal range for the first time in years. Her cardiologist was so surprised, he personally called me to ask what I'd done. Today, Margaret is going to explain something unique. She's going to describe exactly what her body feels when she does this technique, because you need to understand that it works. You can feel your nervous system shift in real time. And after that, I'm going to teach you the 3 exact points, the exact pressure, the exact sequence. If you have high blood pressure, if you take medications but are still worried, if you're afraid of what happens to your pressure while you sleep, this is for you. I have Margaret waiting, and she's going to be very honest about what she felt, the good and what scared her at first. Let me call her.
Hello, Dr. Matsumoto, I'm here.
Margaret, thank you for doing this. I want you to tell them something specific, what you felt the first time you did this technique, not just the results, the actual sensations.
Oh, absolutely, because that's what convinced me it was real, Doctor. Hello, everyone. My name is Margaret Davis. I'm 68 years old, and 4 months ago I was terrified of going to sleep. Not because of nightmares, because my blood pressure monitor told me a scary story every night. See, I have one of those home monitors, the kind you wear on your arm that takes readings automatically through the night. My doctor had me use it because my daytime pressure was fine, controlled with medication, but he suspected something was wrong at night. And he was right. The monitor showed my pressure spiking to 180 over 110 at 2 a.m., 175 over 105 at 4 a.m., numbers that put me at serious risk for stroke. He increased my medication twice, and the nighttime numbers barely budged. I was scared, really scared. Then I came to Dr. Matsumoto, and he asked me to do something that seemed too simple. He said, "Tonight, before you get in bed, I want you to press on these 3 points on your thumbs, 3 minutes total, then go to sleep with your monitor on." I did it. And here's what I need you to understand, because this is what made me believe. As I was pressing on the first point, right at the base of my thumbnail, I felt something. It wasn't painful. It was a release, like something that was tight suddenly loosened. My shoulders dropped. I didn't even realize they were tense until they relaxed. Then the second point, on the pad of my thumb. When I pressed there with the right amount of pressure, I felt this warmth spread up my arm. It sounds weird, I know, but it was like turning on warm water inside my arm. And my breathing changed. It got slower, deeper, without me trying. The third point, at the center of my palm where the thumb connects, that one was different. When I pressed there, I felt my heart rate slow down. I could actually feel it. My pulse in my neck went from fast and hard to gentle, and I thought, something is happening. This isn't placebo. My body is responding to this.
And what did the monitor show that first night?
That first night, my 2 a.m. reading was 155 over 95, still high but 25 points lower than usual. My 4 a.m. reading was 148 over 90. I woke up and looked at the monitor and I actually said out loud, "What?" I did it again the second night. Same technique. 3 minutes before bed. That night, 150 over 92 at 2 a.m. 145 over 88 at 4 a.m. It kept dropping, night after night. By the end of the first week, I was consistently under 140 over 85 all night long. By the end of the month, I was hitting 130 over 80, normal range throughout the entire night. My cardiologist was stunned. He asked what I'd changed. I told him about the thumb pressure technique. He was skeptical at first, but then he looked at 4 months of data from my monitor. The pattern was undeniable. He said, "I don't know how it works, but keep doing it."
Tell them about what happened when you forgot to do it one night.
Oh, yes, that's important. About 2 months in, I was exhausted one night. I got in bed and forgot to do the technique. The next morning, I checked my monitor. My nighttime readings were back up. 168 over 98, 172 over 100. One night of not doing it, and my pressure went right back to where it was before. That's when I knew for sure. This wasn't coincidence. This wasn't my medication finally kicking in. This was the technique. Directly. Immediately. Cause and effect. Now I don't skip it. Ever. It's as essential as brushing my teeth. 3 minutes before bed. Every single night. If you're scared of what happens to your blood pressure while you sleep, if your daytime numbers are okay but you suspect your nighttime numbers are high, this works. But you have to do it correctly. The right points, the right pressure, the right sequence. Listen to what Dr. Matsumoto teaches you. Do it exactly as he says. And check your results. Your body will tell you it's working. You'll feel it, just like I did.
Thank you, Margaret. That description of what you felt, that's exactly what people need to hear.
Thank you, Doctor. You gave me back my peace of mind at night.
What Margaret described, those physical sensations, aren't imaginary. They're real responses from her nervous system. Let me explain the science behind this. Your blood pressure is controlled by two opposing systems in your body. The sympathetic nervous system, the accelerator. It raises pressure speeds up the heart, prepares you for action. The parasympathetic nervous system, the brake. It lowers pressure, calms the heart, puts you in rest mode. The problem is that most people live in sympathetic mode all day, and when night comes, their body doesn't know how to switch to parasympathetic mode. Your medications can control pressure during the day, but they don't activate the parasympathetic system. They don't tell your body it's time to truly rest. That's why your pressure rises at night, because your nervous system is still in alert mode, but your thumbs have something special, pressure points that are directly connected to the vagus nerve, the master nerve of the parasympathetic system. When you press these points correctly, you're literally flipping the switch to rest mode. Margaret felt her shoulders relax. That's the sympathetic system turning off. She felt her breathing become slower. That's the vagus nerve activating. She felt her heart calm down. That's her pressure starting to drop. It's not placebo. It's direct physiology. Now, let me teach you the nighttime thumb pressure technique for blood pressure. 3 points, 3 minutes. Preparation. The right timing. Do this 10 minutes before going to bed. Not in bed. Sit in a chair or on the edge of your bed. Why? Because your body needs to process the vagus nerve activation before lying down. If you do it while already in bed, it may not be as effective. Point 1. Base of the thumbnail. The releaser, 1 minute. Take your left thumb with your right hand. Place your right thumb right at the base of your left thumbnail, where the nail meets the skin. Press firmly, should feel intense but not painful, and hold for 30 seconds. Then switch hands. Press the base of your right thumbnail. What you'll feel? Tension releasing in your shoulders and neck. It's the first sign that the sympathetic system is turning off. Why it works. This point, called Shaoshang in Chinese medicine, is connected to the vagus nerve in your arm. Activating it starts the parasympathetic cascade. Point 2. Center of thumb pad. The activator, 1 minute. Now press on the fleshy center of your thumb pad, the soft, round part. Press with circular motion, deep for 30 seconds on each thumb. What you'll feel, warmth traveling up your arm. Your breathing will become slower and deeper automatically. Why it works. This point stimulates receptors that tell your brain, we're safe, we can rest. Your brain responds by lowering stress hormone production. Point 3. Base of thumb on palm. The stabilizer, 1 minute. Finally, press where the thumb connects to the palm, that fleshy point at the thumb base. Press firmly and make small circles, 30 seconds each hand. What you'll feel, your heart will calm down. You can literally feel your pulse become slower and gentler. Why it works. This is the vagus nerve master point for the cardiovascular system. Pressing here directly lowers heart rate and blood pressure. Final step, integration, 30 seconds. After the 3 points, sit still for 30 seconds. Close your eyes. Breathe normally. Just observe. You'll notice your breathing is slower. Your body feels heavier in a good way. Your mind is calmer. That's your parasympathetic system fully activated. Now go to bed. Your body is ready to keep your pressure stable all night. Something crucial you need to understand. This does not replace your medications. If you're taking blood pressure medications, keep taking them. This technique complements them, it doesn't replace them. But what it does do is attack something medications can't, your nighttime stress response. And if you have a blood pressure monitor at home, use it. Measure before doing the technique. Measure an hour after going to bed. Measure during the night if you can. Numbers don't lie. You'll see the difference like Margaret saw it. Nocturnal hypertension is dangerous because it's silent, but it's also treatable, not necessarily with more medications, but by activating the right system in your body. If this video taught you something new about your blood pressure, subscribe to this channel right now. Every week, I share techniques like this, solutions based on traditional medicine that complement what your doctors give you. Hit subscribe, turn on the notification bell, and share this with someone who has high blood